right, I want to thank you for coming. Obviously, we want to give an update to the public before the weekend, so we thought maybe we'd do a run through the numbers and talk about a couple other items that are on the agenda or on the horizon. Today's dashboard, as we're getting a lot of hits, so I think the public is becoming accustomed to it. It's a new dashboard. Some of the important things on here we really want to keep an eye on are the hospitalizations at 38 right now. And, you know, when we were going through the pandemic in the earlier months, we weren't seeing the kind of numbers we're seeing now. So, you know, the number of hospital beds that were available really wasn't a concern. But now we're keeping our eye on it. We're in constant contact with Arnold to make sure that, you know, we have the room for more beds should the need arise. Another big area is the Meyer Correctional Facility. We're keeping an eye on those numbers to make sure they continue to go down. Because as they continue to go down, hopefully our daily new cases will go down, our 7-day rolling average will go down once we get those cases that they put into the system all at one time, once we get past that 7-day period. Very impressed with the 67,000 tests. When you figure we live in a county of around 85,000 people, we've given 67,000 tests, so that's pretty good. And I think, like we talked about earlier this week, our testing capability today, as opposed to what it was 6 months ago, is phenomenal. So we have to be pleased with that. But we still have a long ways to go when it comes to the school testing. We're going to need some assistance from the state and federal government as we move forward. And new cases today, 53. Hopefully that will go down over the weekend, because that always helps the numbers that the governor's office is looking at to move us out of the orange and yellow zones. Pause complaints continue to come in. Pause complaints are the governor's system for complaints involving social distancing violations, facial mask violations. They come into a website and then they're forwarded to the sheriff's office and the county executive's office, and then we investigate them from there. Since October 21st, when we were advised that we were going into the cluster zones, we've received 74 complaints via the pause system, and total complaints to date, 988 via the pause system of complaints that have come in through the website. And you have to remember, we also get complaints that directly come into the county executive's office, directly come into the health department, to the 911 center, and the various law enforcement agencies. So a lot of complaints out there that are coming in, and, you know, we try to validate which ones are of public health concern and which ones we can investigate, because at the end of the day, we truly don't have the resources to investigate them all. You know, and just as an example, if a complaint comes in that I was at the local store and I saw somebody without a mask, well, you know, we can talk to the store owner, but the person that wasn't wearing the mask is long gone because of the delay of when the county actually receives the complaints. Meyer Correctional Facility, obviously we know that's been a big topic over the last week and a half, 2 weeks. On Wednesday, the public health director and I had the opportunity to have a conference call with the acting commissioner of the Department of Corrections out of Albany and all his senior staff, so we could really get, you know, the lowdown on what's going on at the correctional facility, how are they handling the situation, and the importance of information sharing so that the county public health director has the information he needs to keep people outside of the facility safe. Some of the topics we talked about were quarantined and isolated inmates. We were really concerned with, we know that they have a maximum capacity of approximately 1,800 inmates. So if they have 1,800 inmates there, how are they facilitating the process to properly quarantine and isolate inmates? So that was very important to us. Testing procedures involving staff and inmates. I mean, that type of information needs to be a two-way street, just because when they're going to dump, you know, 300 to 400 test results into the system and they hit the public health department all at once, that's an alarming number of positives that we received, and really got us kicked off to, you know, where we were with the issues involving the correctional facility. Communications with local hospitals. The public health director wanted to make sure that the prison is communicating with the hospitals. We just talked about the hospitalizations and the bed availability, so we need to know, you know what, we realize they have an infirmary within the facility, but you know what type of equipment do they have to facilitate respiratory failures and complications, so we were able to discuss that. And we were also interested in, where does testing go from here? Is there going to be additional testing after the 14-day initial tests were given? I believe they said if there were people who were symptomatic, they would retest, but For the meantime, they do have a plan. I think the public health director and I felt very confident after the phone call with what they've done to this point, what they're doing now. I mean, obviously we know we're at the point of community spread because we have individuals who work there, correction officers and civilian staff. We also discussed the process and the numbers of the Southport Correctional Facility, and was there a reason why there was such a fluctuation? I think we have maybe 2 at the Southport Correctional Facility compared to the hundreds that we've had at the Meyer Correctional Facility. All inmates at the Myra Correctional Facility have been tested. That's over 1,400 tests. We were advised they've all been completed as of September 25th. And it was just a matter of getting the results back. I would hope that we have the results back by this point for all those tests. 590 original positives is what the commissioner told us they had from the facility. 920 negatives they had from the facility. 45 positives for staff members, and approximately 20 individuals are isolated or quarantined because of loved ones or whatever were most likely positive. So again, we had the opportunity to ask a number of questions. We got all the answers. We were satisfied with all the answers, and we'll be on the same page as we move forward as they get ready to either retest the individuals who seem to be exhibiting symptoms and so forth. So very fruitful meeting with the Commissioner of DOC, so we're appreciative of them taking the time. We're getting a lot of questions as to yellow and orange zone. When are we going to come out of that yellow and orange zone? Look, we don't know at this point. We were told that the governor's office will reevaluate in 2 weeks. So this Wednesday, hopefully we'll probably hear something. From when they told us we were going to go into the orange and yellow was Wednesday. When we implemented it, though, remember, it was Thursday at midnight for Friday. So we'll see what happens. The 7-day rolling average that the health director will talk about in a minute really it's not going down quick enough at this point to where my guess is we're going to be removed from these zones, but we'll see where it goes and what kind of weekend we have. We had some great testing that I'm sure Pete will talk about later with the school district as far as the numbers that came back. We were very happy and pleased with those numbers. So again, this isn't a county decision. This is the governor's decision. When the governor says we're out of orange or we're out of yellow, that's when it will happen. Until that time, we have to continue to enforce the rules put in place when you have a cluster orange or a cluster yellow. There are other areas in the state that have also been put in these cluster zones. And remember, the whole goal now, as opposed to making the whole region go back to orange or go backwards, is to focus on an area where you see the problem, where you have the density of population, and then you put a buffer zone around it, and hopefully that stops the spread from traveling in any given direction. We're still working with our counterparts in Pennsylvania, Bradford and Tioga County, watching those numbers to see what direction they're going. We're not seeing huge spikes like we thought we might. So, you know, at the end of the day, is our community spread going to be attributed to Pennsylvania? It doesn't look like it. But then again, as we watch their numbers, their information data entry seems to be about a week behind in anything we're looking at. They don't keep the records like the individual counties do in New York State. Early voting during the pandemic, just a reminder, please remember you need a mask. Please, we would like you to adhere to social distancing. We understand a ton of people want to vote, and we want them to vote. But I want to thank Mayor Mandel and the Meyer Police Department for our first day of early voting on Saturday. Everybody was packed in, so we had to send some folks over and ask people, please spread out. Please make sure you have your mask on if you're not with an immediate family member. So early voting has been going very well. I'm very impressed. Almost 5,000 people have voted so far in Chemung County for early voting. I mean, so that is phenomenal. I think our biggest day was about 1,008 people on maybe Sunday or Monday. So maybe we can beat that this Saturday. I mean, even with the weather yesterday, we had 800 people vote. So people are really taking to the early voting right now. So again, please remember the safety measures in place and please social distance properly. Halloween safety. You remember that the Public Health Department, the County Executive's Office, we recommended that you didn't have trick-or-treating in the various neighborhoods, but we realized that some of the smaller neighborhoods are going to go ahead with the trick-or-treating. Again, we want you to remember your 6-foot social distancing. These are recommendations from the CDC in reference to Halloween safety. Avoid contact with other trick-or-treaters. Give out treats outdoors if possible. Set up a station with individually bagged treats for kids to take. Wash hands before handling treats. Wear a mask. Remember, they don't recommend the mask that comes with the costume. We'd like to see the medical mask, the cloth mask be worn. Make sure your cloth mask is part of your costume. The costume mask is not a substitute for a cloth mask. Do not wear a costume mask over a cloth mask. It may make breathing difficult. And masks should not be worn by children under the age of 2 or anyone with trouble breathing. And remember, these are recommendations of the CDC. With that being said, I'll have our public health director come up and go through all that interesting statistical data.
Thanks, Chris. First of all, I just want to start off real quick and just thank my team at the health department. Everybody that I work with over there has been fantastic. 6-7 days a week, 10-12 hours a day since February. They've been fantastic. All the testing events that we've done, all the other planning and things we've done in the last minute, weekends. In addition, the other county departments, county executive's office, IT department, buildings and grounds, DSS, sheriff's office, everyone's been fantastic to work with. So I just wanted to give a big thank you to all those people. So this is our graph for the daily new cases, and as we've talked about in the past, back in April when we had our apex, our numbers have far exceeded all of that. Last 28 days, there's been 1,537 new positives. If we put that into perspective, for the local health department to conduct that many case investigations is phenomenal. It's a situation we never expected to be in, but I'm not surprised that the team of the health department was able to get through all of those with additional help from staff members from other programs that have been brought in. We worked with them to train them and continue to work with them, and they're providing us a lot of assistance on the case investigation side. So with that goes the number of people on mandatory quarantine and isolation. So keep in mind, these are people that we make contact with once a day through a variety of methods, either FaceTime or some kind of visual software that we're able to use, or through a visit. So that also includes, we have to go out to people's homes a lot of times, drop off isolation orders. If they need a thermometer or there's some other things that we may be able to help them with, we're doing that too. So our staff is out in the community. We're checking on these people. When we check on them, we want to make sure that, one, they're abiding by the isolation or quarantine, but also check their symptoms, make sure if they need to get any further assistance, medical or otherwise, that we're there to provide assistance for them. So this is the breakdown of the results from our testing event last week. As a reminder, we had a 5-day testing event from Tuesday to Saturday, opened to the entire public of Chemung County for anybody sick, either asymptomatic or symptomatic. It was at George Washington School. Our total count over the 5 days was 1,230 with 69 positives for a total positivity rate, percent positivity rate of 5.61%. So this I think represents a lot of planning on the part of the health department. We do want to thank Hillary and her staff at Meyer School District for allowing us to come in and set up at George Washington. We've maintained use of that facility this week and plan to use it in the future as well to conduct additional testing events. It's worked out very well. The staff at the health department was able to set this thing up, roll it out rather quickly, and then once we had 1 or 2 days, it became very smooth and efficient of an operation. So this is the graph of the percent positivity rate since October 9th. And as you can see, we had a huge uptick that's representative of that large number of cases, as the county executive mentioned earlier, dropped into the Eclair system from a Meyer Correctional facility. As you can see, we've gone up and then down, and then we're back down again. According to the metrics, we've got to come down considerably in order to get out of that orange and yellow zone. So, hopefully this small drop will be continued, and we hope to see ourselves getting out of that orange zone. But at this rate, it doesn't look like that drop is going to be fast enough or consistent enough yet. So we'll keep an eye on that. So this is the state dashboard for percent positive tests per day, 7-day rolling average. And again, to reiterate, this is ours is the same. It's the 7-day rolling average. And as you can see, this is the southern tier. As you go across, we have seen that uptick. It's not just here in Chemung County. Our neighbors in the southern tier, as well as the Finger Lakes, are seeing the same kind of increases. So when we look at the state's early warning systems or data here, we still see that if you go over the fourth one, new cases per 100,000, still seeing about 27. Per 100,000. That's something that went up, specifically for Chemung County about 6 weeks ago, and has stayed, high for us, and has risen in other southern tier counties. So, that's something to pay attention to. Percent positive rate for the entire southern tier region is still low at 1.3%. We're happy that the other counties in the southern tier aren't seeing the same rise as us. We're working the best we can on the health department side to try and push out educational messages, really work with other agencies, and provide assistance when it's needed. Again, this is the state data for the new cases per 100,000, and as the previous two slides show, again, we have that huge uptick probably around Labor Day, and it continues to go up. And again, it's not just stuff, we're seeing this across southern tier region and the Finger Lakes. We're still looking at information from Pennsylvania. We really take a closer look at Bradford and Tioga. So a little bit of perspective, Bradford last week I think was plus 48. Tioga I think last week might have been plus 10. But 5 weeks ago, they were like plus 1, plus 3. They're seeing the rise in cases as well as we are. So again, this is the Johns Hopkins webpage, and this shows the curve for all the states in the country. And it's interactive, so you can click on it and gives you the breakdown similar to what's on the top for us here in New York State. What's nice about it is it's color coded. The redder it is, the steeper the increase. So the faster they're seeing the higher number of cases. The greener it is, the steeper the decline, or the less new cases that they're seeing. So as you can see, various shades of pink, unfortunately, across the map. Shouldn't come as a surprise for anyone reading the national news and things about COVID. This was as to be expected. It's been talked about. Dr. Fauci talked about it, State DOH talked about it, CDC talked about it. When the weather gets colder and we all start to move inside, greater chance increases our risk for COVID-19. So, microcluster 7-day rolling average. The state, uses several things that they looked at, to assign us to orange and yellow. One of the things was the percent positive. So if you look at this, across since start of 10-14, 10-4 to 10-10, 10-11 to 10-17, 10-18 to 10-25, you see that goes up. That's pretty reminiscent of our numbers as well. In addition, when you see that 7.05, certainly far greater than what we wanted to see, far higher than what we were experiencing before, but it just goes to show, the problem that we're dealing with here in Chemung County with the excessive number of cases. And again, just as a reminder, the holidays are coming up. We've got to maintain our mask use. I know we want to have dinner and lunch and get-togethers with our family, but really, those family get-togethers, the family that you live with, that you share a house with, if you have get-togethers with other family members, it greatly increases your chance for COVID-19 transmission. Again, you got to have that mask on within 6 feet. Try to get that social distancing. What we're seeing a lot of times is meals kind of play a role. If you're having a meal, you can't sit within 6 feet of other people. County executive and the health department are working on some tips and advice for what to do for Thanksgiving, so that should come out in the near future. Again, county executive mentioned it about Halloween. We've been working with the municipalities, answering a lot of questions. I think there's a lot of, at this point in time, common sense things that we can do. Stay 6 feet apart, wear your mask, and the additional pieces that were mentioned earlier.
And Pete, could you touch a little bit on some of the challenges that you're facing with the school districts and the testing for the 20% of support staff and teachers, and how many resources we have, and how long it will take us without additional test kits and assistance from the state or federal government? Sure. So when we were originally provided the Abbott rapid test machines and the test kits, we really wanted to roll out a community testing event. We were able to do that. When we were put into the orange zone, where the school districts are required to test 20% of the support staff
those are the people in the building that are needed to allow for that remote learning for the students. So the requirement is for 20% testing for those staff members. That's something that, you know, we worked with the schools and said, you know, what can we do to help you out? They have zero testing capacity. So we had the machines and the test kits. We worked closely with them late last week, weekend, earlier in the week. You know, we worked with IT too to see what we could do to work on, you know, additional things through our IT department. The challenge is that you know, the schools have, you know, a lot of moving parts, and there's a lot of different schools. We did this for every school in Chemung County, both public and private schools. They had to provide the list of all their staff. They had to, you know, advise their staff of when to go. One of the challenges was, you know, and the schools had said, you know, it's awfully difficult for us to send, for instance, 170 people over in 4 hours. Can we split it up across the days, because we were running 9 machines, and that took a little bit of extra planning, but I think it worked. And I think with the numbers that we had for testing, we tested about 430 over the 2 days. We had 1 positive. So over 2 days, 430 tests, 1 positive. The asterisk with that positive is that was someone that had previously tested positive several weeks ago. Per the CDC and state DOH guidelines, you know, they're saying that once you're past that 10 days, once you're positive and you're through that 10 days, you're no longer infectious, but you could still be shedding virus to trip the test, but not in a manner that still makes you communicable to others. So this is somebody that got tripped up in that test. So we feel that those numbers are extremely successful. I will point this out. The Abbott machines, you know, it's about 15 minutes per test. They're shorter if you're positive. The machine really runs out to 15 and maybe a little bit longer when you're negative. So with all those negatives, we weren't as ahead of the game as we have been in the past. It's I think something nice for us to experience because that hadn't been our experience in the past. The challenge moving forward is, again, we're working on a second testing event for the schools this week, but the county executive and I have been working on bringing in a new platform that the schools can use and advising them how to use it, how they can make it use for themselves, and that they can do it on site. So that helps in a number of ways. One, they can do it on their own, and once we move out of orange into yellow, they're going to have to test not only 20% of the staff on site, but 20% of the students. So those tests that we did yesterday, and the number of 430 is going to go way up. I mean, it could be you know, over 1,000, maybe 2,000. So there's going to be something needed for the schools to be able to accomplish that.
Take some questions, B. Go right ahead.
Sure. All right. Go ahead.
How likely is it, are you able to see a spike after Halloween? Being as though some people are going to go trick-or-treating, there may be some parties.
Yep. I will tell you, we'll be looking at 10 days, 14 days from Halloween. I'm very worried. You know, I get it. I know we're all tired. We're all sick of masks. We're all sick of not seeing our families. But the public really does have success in their hands for this, and it's the public health prevention strategies we use successfully, you know, late spring, early summer, you know, the mask use, the social distancing. Our case investigations are really showing us it's the small get-togethers, you know, that are causing the new positive cases, and we have extreme worry about the holidays coming up, and then we're going to see more of that. So we're definitely looking at that. I hope that's not the case, but, you know, county executive, I have had conversations on, you know, Halloween's on a Saturday this year, so I think that, you know, kind of adds a little bit to it. So hopefully with the municipalities and everything that we've put out for Halloween, people really, it's in the front of their minds, you know, to wear the mask when you're within 6 feet, social distance. If you're sick, stay home, and make sure to wash your hands.
And staying on topic with Halloween, I thought that trick-or-treating was not allowed. Is it allowed?
Yeah, the county has not canceled
Okay.
Halloween or trick-or-treating or any of that. The health department worked with the county executive and the various municipalities and provided guidance and what we thought might be most beneficial for them, but it was not canceled or anything like that.
Okay, and also, what's the positivity rate right now, and what does it need to be to get out of the orange zone?
The positivity rate today is that 6.7?
Yeah.
We have to be below 3.5?
That's what they'd like. But I mean, remember, the governor's office said they would review it. He said there is no set. If we were close to that, they would let us know. They wanted to review it for 2 weeks, so they'll review it for 2 weeks, and then they'll let us know. So hopefully, if we can trend down, but I don't know, like the director said, if we have enough time to trend down low enough by Wednesday to get out of the orange zone, but we'll find out by then. And just a quick follow-up on Halloween, it was recommended that the local municipalities don't do trick-or-treating. Remember, there are mass gathering orders in effect for the orange zone and the yellow zone and the green zone. And we had a meeting with the municipalities this morning, as well as the sheriff's office, and they will be out in full force, making sure that the mass gathering rules and that there are no Halloween parties. We had the 911 director on the call as well, and we'll have staff on to handle the extra calls. So please don't violate the mass gatherings. Please, if you're going to trick-or-treat, utilize the rules that we showed you earlier, and everybody needs to stay apart, stay spread apart. Our advice is stay home, watch a scary movie.
What is the bed capacity in Arnold?
I don't have that number just off the top of my head. One thing I can say, we speak to Arnold every day. We share numbers back and forth. They have a surge plan. You know, they were required to. They were working on it beforehand, but then they were required by the state to have that in before probably March or April when it was due. So that's something that we're monitoring closely. I just don't have that off the top of my head.
I know you went over this a little bit, for whoever wants to answer it, but you said it might not be likely for that number to drop quick enough to be out within the 2 weeks. How likely is it that it will be extended?
Well, again, that'll be up to the governor's office. So, I mean, we hope we've peaked right here at 11.27. Let's hope that we don't go back in that direction. So, you know, with Friday, Saturday, Sunday's numbers, we'll look at it Monday morning, and hopefully we'll go down another percentage point or two. Obviously, it'll depend on how many tests are given and what the results are, and we'll keep an eye on that. And, you know, if the governor's office says, you know what, it looks like it's going in the right direction, you know, and remember, we don't go exactly back to green. If you're in orange, that goes to yellow. So we still have a process to go through. And then they want a buffer zone around that. So it'll be interesting to see, and you know, I'd ask the folks to remember, the residents to remember, Pete and I are making this decision. This comes from the governor's office. When he says there's no more orange, there's no more orange. Yes?
I know that you all put like heavy enforcement on the businesses that had to close down for 2 weeks. Have you had any people that weren't abiding by the rules?
We continue to receive complaints. We've had the sheriff's office, all the local municipalities have pitched in, the health department, the sanitarian, so everybody's been out. We've issued multiple warning letters where the business has 48 hours to take corrective action. If they don't, the sanitarian or deputy sheriff or code enforcement will be back by to pay them a visit, and then it will be a fine. So multiple warning letters, but no fines as of yet. You know, look, there's some business people who are upset. I don't blame them. We've gone backwards and closed businesses down again. It's going to be hurtful for sales tax revenue. It's hurtful for restaurants, all the personal care, the fitness centers that waited all this time to open are now closed again. So the best we can do to get them open back up is to get this number down, and the best way we know how to accomplish that is facial coverings and social distancing.
I'm sorry. As you talk, I just keep getting more questions. How much is this costing the county? The stopping the businesses, the testing the results, the opening up a testing area, and then having all this come about. How much is this costing the county?
You know, it's hard to put an exact number on it right now because obviously there's going to be a sales tax hit. We know right now that's going to probably be between $2 and $4 million. We'll see where we end up after the final quarter. And then you have to think about all the PPE equipment that we bought that we're not going to be reimbursed for, you know, through the CARES Act or so forth. And then we've got personnel on overtime that, I mean, this is a 7-day a week operation. I've got employees from departments assigned to the health department to assist. So, I mean, there's going to be a big dollar amount to it. We'll probably talk about it a little bit during the budget address in the coming days. Okay? Great. Everybody have a great weekend. Thank you for coming. We appreciate it.